Okay, welcome everybody to our weekly chat with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey, joins us again this week. Thank you for joining us, Doctor.
Yes, my pleasure.
So my name is Dilshad Burman. I am a writer and reporter with CityNews and 680 News, and I will be moderating this chat today. Normally we start at 12:30. We had some technical difficulties, so we're starting a little bit later, but the doctor has agreed to stay on a little bit later so we can get in as many questions as possible. How this works, of course, is that you have been submitting your questions over the past week. We've been collecting them, and we will ask the doctor. If you haven't had a chance to submit your questions, you can do so under this broadcast, and we'll try to get to as many as we can. All right. So, Doctor, are you ready to go?
Yeah, let's go.
Okay, let's go. Starting with vaccine questions this week, because, of course, the vaccine is coming out. Everybody is quite concerned. So let's start with Kathy. Kathy asks, if you have had the coronavirus, would you still need to get the vaccine?
So it's hard. The answer probably is yes, it's a good idea. But the studies that were done actually excluded people who they knew had already had COVID. There is, though, a recommendation that, you don't need to necessarily test everyone to see who had it, who hasn't had it, to give it. If you have short supply of vaccine, well, then you especially want to make sure that those who haven't had COVID get the vaccine first. But we do know that there is a small but present risk of getting reinfected. So even if you've had it before, that doesn't necessarily guarantee that you won't get it again. And that's why, you can still get vaccinated.
Right. Okay. And then let's move on to the next one here. Jason asks, when is the list of ingredients going to be released so that we can do our research before we choose whether or not to take the vaccine?
Right. So for this Pfizer vaccine that's been, it's approved by Health Canada, and the product monograph is available. And so the ingredients are listed. There are not a lot of well-known ingredients in it. And so you can actually look that up on the product monograph.
Okay. So that's for the Pfizer one. The Moderna one, we don't know yet, because it's not even.
It hasn't been licensed in Canada. So once a vaccine is licensed in Canada, then the product monograph is available for Canada. Yeah.
Right. And then let's see. Gail asks, how do we know what medications we are taking right now? How do we know that the medications we are taking right now might not interfere with the vaccine, whether whether the vaccine makes them more or less effective, or the medication makes the vaccine less effective?
So we have the data based on the studies that have been done, and they did not exclude people who were on medications. People who had chronic conditions, who took medications, did get vaccinated. And then they compared the two groups of people who were vaccinated and unvaccinated. And they didn't find that there were any particular signals or indications that certain medications might interact. I mean, I think the one thing to say is if you have a weakened immune system and you're on medications for that reason, the vaccine has not been studied in that group.
Right. And so again, in that case, I suppose it's a personal decision, but one of those things where you have to really weigh the risks in order to, decide whether you need to take it or not.
As a person, but as a recommendation, you can't recommend it because it's really not based on data, but each individual person could decide for themselves. Yeah.
Right. So it's not recommended then for people who are on immunosuppressant drugs to take the vaccine?
Because it has not been studied in them, right? So we can't definitively say, but if you felt that if you're on an immunosuppressive drug and the risks of getting COVID were much higher, you might choose to get vaccinated. Again, right now, nobody has that choice because the vaccine is not, it's not freely available to everyone. Yes. But the same goes for if you're pregnant or breastfeeding, for example, or if you're a child, like the vaccine has not been studied in those groups.
Right. Okay. So the recommendation is not necessarily for those people to take it. Okay. And then Brian has an interesting question. If one gets the first dose of the COVID vaccine, is getting the second dose a month later guaranteed? And is getting the first dose without getting the second dose just a waste of time?
If you want the best protection, you really do need the 2 doses. The studies showed that the first dose, after the first dose, before the second dose, some people did get COVID. And so it's that second dose, a week or even 2 weeks after that second dose, that you will have the best protection. So if you really want to be protected against the vaccine, it's the 2 doses that are required. Now, if you had 1 dose and you had a reaction, well, you're not going to get that second dose, right? So there may be some instances like that, but for the full protection, that 95+% protection efficacy, you do need the 2 doses 21 days apart.
21 days apart. Okay, I guess the question is more about supply then, because Canada has to have enough vaccine to give everybody the vaccine twice, essentially. And so
exactly, and so the calculations are being based on that it's 2 doses are required, rather than giving everyone 1 dose and waiting for more vaccine. It's based on that whoever you give it to needs a second dose.
Okay, so it's been calculated that way, right? Okay. M asks, and I guess this is sort of more of a personal question to you then, do you feel like people will be comfortable taking a new vaccine when most of the most effective vaccines take years to create?
Yeah, I mean, this is, again, novel technology. It has been studied. We only can talk about the 3 months or so of data that we have, but we can say in general what we know about vaccines, what we've seen based on the science. I think here the balance is the benefits versus the risks. Mm-hmm. And it's the risks of COVID. I mean, in a long-term care home, if you are an older person, the risks of COVID are quite severe. If you get it, you can get quite severely sick and can die from it. And so that balance of the benefits versus the possible risks is different for every person. And that's going to be a big part in the decision-making to get the vaccine.
Absolutely. And then Tatiana asks, could you please address the safety of the new vaccine based on the fact that it is a new type of vaccine affecting your mRNA, unlike regular adjuvant vaccines?
Yeah, so this is new vaccine technology. The way it works is the messenger RNA comes into your cells. It makes your body to actually make a protein. The protein then stimulates your own immune response to fight COVID. And then by doing that, it actually responds by attacking the messenger RNA that was part of the vaccine, actually. So it won't stay with you forever. That's the way the vaccine works. Again, all we can say from a science perspective is we have 2 to 3 months of data for the safety, and we can go based on principles. We know the vaccine works against COVID, so it will at least protect you against that risk. And then, we can only say what we know, and beyond that, it's an informed consent based on the benefits and the risks. Yeah.
Right, absolutely. Okay, let's see. Bad Uber X asks, if the virus continues to mutate, will the vaccine still be effective?
So again, the vaccine stimulates a response to this one protein on the virus. It's not the whole virus. So as long as that one protein on the virus doesn't change, even if there are slight changes in the gene makeup of the virus, then the vaccine will continue to protect.
Okay. Are we looking at, though, because we've talked about this before, when it comes to the flu, it mutates every year and we have a slightly different variation of the vaccine every year. Do you see that as a possibility when it comes to COVID?
Yeah, it's a good question. See, the thing is, our flu vaccine is actually made up of the strains that are circulating and tries to match those in the vaccine. What we don't have is a flu vaccine that is like the COVID vaccine, that gets your body to produce one of the proteins or, one of the antigens on the flu that don't change. We don't have a vaccine like that for flu. We certainly do. And so that may be one reason why this vaccine may be able to be stronger if there are slight changes or mutations of the SARS-CoV-2 virus. But again, it's all based on what we think we know about this vaccine and the technology compared to, say, other vaccines. Yeah.
Right. Okay. And okay, let's move on to some testing questions here, mostly about delays. Donna asks, why is it taking 5+ days to get my results? My 11-year-old is still isolating at home.
Yeah, so this is based, the labs are the ones that do the testing. And so when you get your test done at the assessment center, depending upon, do they do the result there? Do they send it away? And then the lab has its own capacity. So this is certainly something you could actually go on our website to see what the testing turnaround times are for our city. I actually checked that yesterday. About 75% or so are getting turnaround times within 48 hours, but that still leaves one in four that are not. So this is something that is being worked on provincially. Ontario Health is the lead, and we do certainly recognize that it's not ideal.
Mm-hmm, absolutely. And so somewhat related there then, Natalie asks, what exactly is the protocol after you test positive for COVID-19? She says, my family members tested positive between November 17th and November 22nd, and the family doctor actually didn't have any information. He didn't know till they called, and she's still feeling unwell 3 weeks later.
Yeah, so where you live, so if you live in the city of Toronto, we get notified by lab if you had a lab test done, and then Toronto Public Health will call you. Your physician should be able to look up your results and get a copy. Sometimes they get a copy, or sometimes they're just able to look it up. The person who got tested can actually look the result up themselves, and that's actually probably the fastest way to find out. And that's why in schools we actually tell parents, once you know that your child is positive, notify your principal right away, and then the principal lets us know. So we're trying to get access quickly. There have been quite a lot of cases in the city every day, and so that may explain some of the delay with some of the lab turnaround times may be delaying. But once you find out, once you get tested, the important thing is to self-isolate until you get your result. And if it's positive, you'll have to continue to self-isolate. And that's why we do that, to make sure that no one is continuing to expose others.
Right. And just coming back to the family doctor thing, then if you test positive, public health contacts you directly. They don't go through your family doctor. You don't have to wait for any of that, correct?
That's right. Yes. So you will get a call directly from public health. But to say that your family doctor should be able to have access to the report, to the results, if that's one way that you wanted to find out. But you yourself should be able to look it up online. And if you're having trouble finding your results, you can also call our Toronto Public Health hotline as well.
Right. Okay, a little more about testing, not about delays this time. Shirley asks, do the daily counts include those people who tested positive and are in the 14-day quarantine and are testing to find out if they are still positive?
So we don't actually do repeat tests on persons, like to see if you continue to be positive. There are very, very small situations in which we do that. Once you've tested positive, we actually recommend that you don't get tested even 4 months later, unless you actually looks like you have new symptoms. So, and the counts are based on per person. So if someone did have 5 positive results, they would only be counted once.
Right. Okay, let's move on to some other general questions here. Michael asks, what is the risk of playing sports outdoors, like shinny hockey, for example, or even basketball?
Well, outdoors is lower risk for sure, but if you're having close contact with people, there is always that risk that the virus can spread in those situations. And so that's why things like shinny hockey or basketball, that contact is not recommended right now, especially when we're in a stage where we know that people can be contagious without symptoms and can certainly spread it in those settings.
Right. And I think that's been the recommendation from day one, is just if there's any close contact, just don't do that activity.
Exactly. So for now, focus on skills development, skating, that kind of thing.
Yeah, absolutely. Okay, Nia asks, this is interesting. What's the difference between COVID-19 and chronic bronchitis with pneumonia?
So chronic bronchitis is just actually a description. So you have your lungs and you have bronchioles. And when those tubes that go into your lungs are inflamed, that's called a bronchitis. And a chronic bronchitis just means that you've had it for a long time. And so it means that you have inflammation or an infection in the wind pipes that go into your lungs, and those can get infected. And so sometimes that can be caused by a virus like COVID, and sometimes it can be caused by a bacteria, and sometimes it can just be caused by something like asthma or some sort of a medical condition. And so that's the difference.
Right. Okay. And because, like you said, COVID-19 is a separate virus. It's not just the inflammation of your lungs.
That's right. Yeah.
The tubes that go to your lungs, you said.
Yeah.
Right. Okay. Naveen asks, how risky is COVID for kids?
We've seen from the data so far, based on kids who have gotten COVID in the city, is most kids are getting a milder illness. Very few children have been hospitalized, though there have been some, and even fewer still have ended up in the ICU, though there are still some who have done that. We know that children who have a more serious illness are similar to adults. They might have a chronic health condition, something that might put them at higher risk, and that may be why they may be more likely to be hospitalized. But in general, children are getting a milder illness and recovering from it.
Okay. And then this one actually comes from our reporter, Erica. She says a recent Angus Reid poll found that about a third of Canadians are still planning to visit friends and family for the holidays, despite repeated warnings from health officials to not do that and stay within your household. So we know that some are thinking of isolating when they get to where they're going and then getting tested before they see their family and friends. Is that an effective strategy?
I would say no. There's too much risk involved. Right now, COVID is spreading almost across the country. Within the province, the rates are high. And, what does it mean that you're self-isolating? What about the other people that you're going to be gathering with? Getting a negative test is just good on the day that you have the negative test. It doesn't guarantee that, the next day or the next day or the next day that you aren't incubating with the virus. And so, I think it's a very difficult thing to plan for and to implement. And we know that the best way to prevent the virus is to prevent that close contact. Like, if you really want to prevent the virus, you just have to stay apart. And so I think that's really what the message is, that you can try to reduce the risk, to visit safely. I think still, if the goal is to have a safe visit, the best way to do that is to do that virtually.
Virtually, right, absolutely. Okay, Monica asks, she says she lives in the region of Peel, and the last week of December 2019, they spent a day in Toronto. They went to the museum. They went to a very packed mall. And then the first week of January, she developed a dry cough, fever, etc. And at the time, nobody was thinking of COVID. She went to the family doctor. They gave her 10 days of antibiotics, but the cough took a very, very long time to go away. And now she's saying, it could have been COVID, because she's reading that there were cases of COVID in early January in Canada. Is there anything that she should do now in terms of, whether or not it was COVID?
So the first case in Canada was actually in Toronto, but it was someone who traveled and got COVID, and they were isolated right away. And we're not aware right now that COVID was widely circulating in January in the city. So right now, I don't have any evidence to say, it could have been COVID in January of this year. I really don't have that evidence to suggest that. But I do think, if it was March, like I think, later on in the year, for sure, there are people who might have had symptoms in March when COVID was spreading more commonly in Toronto, that if you had kind of a cold-like symptoms or flu-like symptoms, it could have been COVID. Now, ultimately, you could consider an antibody test. Now, they're not available for anyone who wants it. It's not clear if you got the antibody test whether it would actually, even if you actually had COVID, whether it would still be positive, how accurate that test is. I think regardless, the most important thing, though, is to prevent getting infected now. And so what I would say is the most important thing that you can do is to just take the precautions now.
Right, absolutely. And then we were talking about physical distancing just one question ago. So MJ actually asks, how long do you feel that we will have to continue with these COVID protocols like physical distancing?
Right now, let's just plan for it. I mean, it's not going to be forever and ever, but until we know more about the vaccine protects me, will it also protect you? Will it prevent transmission? How much of a gain can we get? We're going to have to keep at this. We do, in general, for vaccines, need that herd immunity level. And so what is that level for COVID? Is it 95%? Is it 85%? What level do we need in the population to really put a dent in preventing COVID from spreading rapidly in our population? So until then, we'll have to just keep the measures up, but know that we're going to keep monitoring this because, if it's not required, we don't want to make you do it.
Right. Absolutely. I mean, I don't think it's, when measures are unnecessary, we're not going to enforce them, of course. But currently, given that, vaccine hasn't even rolled out yet, we have to just keep going with it through the holiday season, probably well into next year.
For now. Yeah, that's right.
Yeah. Okay. Ruse asks, what are the actual infection rates versus the cases? Is there a difference?
Yeah, so you can actually calculate the rate per population. And actually, if you go on our website, we have a page that has a map of the city, and you can actually see per neighborhood what the rate is per neighborhood or whatever, more than just what the number of cases are that are testing positive.
Okay. And then let's see. This is an interesting one. Ali asks, which is higher risk for catching COVID, public transit or a taxi or an Uber?
So I think they're both different kinds of risks. I think what we have to know is if you're taking public transit or a taxi or an Uber, how can you do it safely? And so for both of them, I would say, go off hours, go just with yourself. Like don't share an Uber, for example, with someone you don't know. On public transit, make sure you're wearing a mask as much as you can. If you can, depending upon where you are, keep a distance or have go off hours. If you're taking a taxi or Uber, we recommend that you sit in the back seat, wear a mask, and if you can, roll the windows down a bit and only be in the back seat with people who you live with. Because if you're in the back seat with a friend, that actually is quite high risk.
Right, absolutely. And Uber pool is probably a no-go altogether because you don't know these people.
That's right, yeah.
Okay, we don't have much time, so I'll just do this one, which is interesting. Canadian Shield asks, if I rent skates instead of buying them for ice skating, can you get COVID if the previous person who was in the skates had COVID?
Yeah, so nice question. I mean, we've actually given guidance to our Parks, Forestry and Rec with the city on how they can use skates easier. And so I think, the risk is if someone has it on their hands and they're tying their laces, and then if you don't clean those laces or disinfect that, so to speak, before you use it, and then it's on your hands, and that's theoretically how you could get it. But I think if you wash your hands before you put the skates on, and then once you put them on, wash your hands again, use your skates, and then do the same when you take it off. And then where you're renting your skates from, they should be cleaning, disinfecting the outer of the skates as much as they can. The other thing that they can do is they can quarantine the skates. So keep it aside for 3 days. And by then, if there was any virus on it, it would be gone. I think the other point is the cold weather. It's not clear how much, but it may also make a difference as well in terms of killing any virus if it's present.
Right. And then Canadian Shield actually asked regarding the sweat of the person prior. It doesn't spread through sweat, does it?
No, so if you put your foot in there and someone else, that would not be a way that COVID has been known to spread. I have not heard of that yet.
Okay. And then we'll just squeeze this last one in and then we'll wrap up. Himanshu asks, is the closed group loop thing still valid? Like, do we still have to practice closed social groups, or is that not valid anymore either?
The only closed social group you have are with the people that you live with. And so there's no social circle, there's no bubble, there's no closed group. It's just the people that you live with. And if you live alone, you can connect with one other household or one other person, but that's all. But it's really with anyone else, you're keeping that physical distance, wearing a mask, and all of those good things.
Okay. All right. On that note, thank you, doctor, for staying a few minutes longer today. And thank you to everybody that submitted your questions. If we didn't get to your questions, we'll try and squeeze them in next week. Thanks again, doctor.
Okay, thanks. Bye-bye.
See you. Bye-bye.